They say the eyes are the windows to the soul, but it turns out they'll tell you a lot about your health, too. These are the eye-related symptoms to look out for, and what they might mean. Although it won't be visible to the naked eye, high blood pressure can damage the blood vessels lining your eyes, which often leads to a sudden change in vision.
I'm seeing double here. 4 crusties!
This is because excess glucose or sugar in the blood promotes swelling and causes fluids to leak into the eye, significantly impairing your vision. Diana L. Seldom-Ridge, ophthalmologist and clinical spokesperson for the American Academy of Ophthalmology, tells Health Digest, "One of the first things we teach medical students is that the eye is the window into the rest of the body. From a vascular standpoint, during a standard eye exam, we can easily detect high blood pressure and blocked veins in the eye. We also frequently see manifestations of diabetes, especially in people who don't have their diabetes well controlled. Doctors can help prevent further vision loss using laser photocoagulation, a procedure in which a laser is used to repair leaking blood vessels in the eye. If you look in the mirror and notice tiny red or white flecks or spots in your eyes, you may have detected a potential cornea infection. Think of your cornea as the clear glass window that allows light into your eye. Otherwise known as keratitis or corneal ulcers, these infections are tiny open sores that can form in the eye's outer protective layer. These sores can be caused by a number of different factors: stress, contact lens usage, injury, fungi, or viruses. Although these infections are often painless, they can trigger itchiness, excess tearing, a stinging or burning sensation, or sensitivity to light. You should consult an eye doctor as soon as possible if you believe you could have a cornea infection. Treatment for the condition usually includes some form of medication or medicated eye drop, but left untreated, a possible infection can progress quickly and in some cases might lead to permanent scarring or blindness. We've all experienced a bout of twitching eyelids. In most cases, this is a painless phenomenon, more of an annoyance than anything else. According to experts, twitching eyelids are often the result of stress, lack of sleep, or some form of substance abuse.
Before this is over, I'm gonna need a whole lot of serious therapy. Look at my eye twitching.
However, a twitching eyelid can also be a warning sign of something more severe: multiple sclerosis. MS is an autoimmune disease that impacts the central nervous system, including the brain, spinal cord, and optic nerves. The disease occurs when the body's immune system misfires, and that can cause damage to a substance called myelin that surrounds and protects your nerve fibers. When the optic nerves that control the movement of your eyelids become damaged or inflamed, a condition known as optic neuritis can develop. Optic neuritis is often one of the first signs of MS, and about half of people with MS will develop optic neuritis at least once in their lifetime. This eye condition often improves on its own, but a doctor may recommend intravenous or oral steroids to help speed up a patient's recovery. Cholesterol is produced by our livers, but as you're probably aware, it's also found in the foods we eat. Although it's vital for the production of new cells, the CDC warns that more than half of adult Americans have cholesterol levels that are too high. Speaking to CNN, Justin Bazan, optometrist and medical advisor for the Vision Council, said, "High cholesterol is one of the easiest things to pick up in an exam. Not a day goes by in my office where we don't detect a buildup of cholesterol. To spot cholesterol, just take a close look at your iris, the colored region in the middle of your eye. Look for a white, gray, or bluish ring around its edge. This is known as arcus senilis, a buildup of lipids and cholesterol that collect within the eye. Although almost every adult will develop some level of arcus senilis as they age, it's most common in men and African Americans. Fortunately, it causes no damage to your vision, so no treatment is necessary. But you will want to do something about that high cholesterol. Floaters, specks, strings, rings, cobwebs, whatever you call them, are not usually cause for alarm.
So what are floaters? Does it mean that you're dying, which is what I thought the first time I had one?
Here's why. The eye is filled with jelly-like fluid. From time to time, tiny strands of this material can clump together, casting a shadow on your retina and creating the appearance of a floating object. A 2013 study published in the International Journal of Ophthalmology reported that 76% of people report seeing floaters regularly. However, when a very large floater or a significant number suddenly appear, it can be a sign of a retinal tear or detachment. When the retina tears, a tiny hole forms that allows fluid to collect under it, pulling it away from the rest of the eye and impairing vision. Similarly, the retina can also become detached due to aging or through the formation of scar tissue. In both cases, if caught and treated early, doctors are generally able to correct the problem and restore vision. Red and itchy eyes are a painful fact of life for the nearly 50 million Americans with allergies. Whether you're sensitive to dander, dust, pollen, or smoke, your eyes will produce a substance called histamine, which causes them to redden, swell, and itch. But those same symptoms can occur in people experiencing a much more serious condition, rheumatoid arthritis. RA is a chronic condition affecting 1.3 million Americans. It occurs when the immune system misfires and begins to attack tissue in the joints, especially collagen. Since the cornea and the white of your eye are both made up almost entirely of collagen, RA can attack them as well. The resulting inflammation often triggers symptoms similar to allergen exposure. Pinguecula might sound scary, but these pink or yellow patches on the whites of the eyes are actually one of the more benign conditions you might face. In some cases, though, they can develop into pterygia, which are symptoms of a condition known as surfer's eye.
Surf's up, dude! Oh, no.
You don't have to hit the waves to experience surfer's eye, though. Anyone who spends a lot of time in the sun can develop this condition. Surfers face the greatest risk, however, because they're exposed to sunlight in two ways: direct sunlight and reflected sunlight. Rays of sunshine bounce off the ocean and reflect back into their eyes, doubling their exposure to harmful UV radiation. While its appearance can be worrying, pinguecula are more like a callus than a tumor. Often located on the inside wide of the eye, closer to the nose, they usually have few symptoms and don't require treatment. That said, they can sometimes become pterygia, and untreated pterygia can cause itching, burning, and even blurred vision in advanced stages. So it's always good to get checked out. Limiting sun exposure and wearing sunglasses when outdoors are the best ways to reduce your risk for developing these problems. If the whites of your eyes are starting to look faded or discolored, it's time to see a specialist. Yellowing eyes is most often a sign of jaundice, and jaundice is one of the primary warning signs for both hepatitis and liver disease. In both instances, this discoloration tends to be the result of problems with your liver. Each day, a small number of red blood cells in your body die and get replaced by new cells. A healthy, functioning liver filters those dead cells from your bloodstream. When you have hepatitis or liver disease, however, those dead cells can collect in the blood. This can cause dark urine, itchy skin, and yellowing of both your skin and eyes. Liver disease is treatable though, and it can sometimes be mitigated by simple lifestyle modifications or prescription medications. As your liver health improves, the yellowing will dissipate. According to the CDC, nearly 300,000 people in the US develop Lyme disease each year. Caused by bacteria spread through the bite of a tick, Lyme disease can be a chronic and debilitating condition. Symptoms include a small rash at the site of the bite, dizziness, joint pain that comes and goes, and fatigue.
It can affect the entire body, and it can actually debilitate people over time.
Some people may experience a non-contagious form of conjunctivitis soon after contracting the disease, and eye inflammation may also occur in its later stages. Additionally, approximately 5% of patients with Lyme disease develop sudden facial weakness in which one or both sides of the face droop. This usually happens a week to 3 weeks after exposure to the tick. Once treated, facial function can return within a few weeks. While full recovery is possible, some individuals may develop permanent tightness in the face or experience involuntary facial movements, such as closure of the eye. If long-term side effects such as these persist, surgery may be required. If you notice one of your eyelids appears droopy, you're likely experiencing something called ptosis. The condition has multiple causes. It could be something you were born with, it might be caused by swelling in the eyelid due to a sty, or it could be a normal part of aging. But ptosis can be caused by other illnesses as well. One of the more rare causes is an autoimmune disease called myasthenia gravis, which occurs in roughly 14 to 20 out of every 100,000 people. Myasthenia gravis can weaken muscles throughout the body, but it most often attacks the muscles that control the movement of the eye. Symptoms include drooping of one or both eyelids, blurred or double vision, difficulty swallowing, and shortness of breath. Since the condition is rare, a positive diagnosis takes time and may require a variety of blood tests and diagnostic procedures, such as a CT scan or an MRI. Does the dark seem even darker to you now than it did when you were a kid? Do headlights glare just a bit more when an oncoming car approaches? This may not be your imagination.
I see darkness.
Night blindness can be a sign of a vitamin A deficiency, or it could be the result of a cataract in one or both of your eyes. Cataracts block the flow of light into the eye, which may make you feel like you're looking through a foggy window. Proteins in the lens of the eye begin to break down as we age, which can create a thick, cloudy layer of tissue over the lens that impairs vision. This condition is common and widespread. The National Eye Institute estimates that by 2050, the number of people in the US with cataracts will double from 24 million to about 50 million. The standard treatment for cataracts is cataract replacement surgery. During this procedure, the affected lens is surgically removed from the eye and replaced with an artificial lens. More than 3 million people in the US undergo cataract surgery each year. More than 8 million people in the US develop psoriasis each year, and about 10% of people with the condition experience psoriasis of the eyelid. Psoriasis occurs when the immune system speeds up skin cell growth. Normal skin cells completely grow and fall off approximately once a month. With psoriasis, skin cells grow much faster, completing their growth cycle in just 3 or 4 days. And instead of falling off, the cells simply pile up on top of each other, causing painful itching, burning, and stinging sensations. When this happens on the eyelid, a person can experience crustiness, pain when moving the eye, and scales that resemble dandruff sticking to the eyelashes. As with psoriasis in other areas, eyelid psoriasis is typically treated with topical or oral medications. Other symptoms to look for include blurred vision, pain, redness, and light sensitivity. From lymphomas to sarcomas to carcinomas, there are dozens of cancers that can develop in and around the eye. Luckily, a good eye doctor is on the lookout for all of these when they perform a standard eye exam. Diana Seldom-Ridge tells Health Digest, starting with the tissue surrounding the eye, we can spot different types of skin cancers, including basal cells, squamous cell carcinomas, and melanoma. Moving in, we check the health of the cornea and iris and look for the different types of cancers that can occur there. To spot potential problems early, the doctor recommends getting a baseline exam of your eyes upon turning 40 and regular follow-ups thereafter.